Many heart attacks don't begin with dramatic chest pain. They start quietly, weeks and even months before. And maybe you are ignoring these signs right now. Let me tell you what to look for before it's too late. Hello, my friends. Each day is a gift, isn't it? Especially as we journey through our golden years. But with this gift comes with a responsibility to listen closely to what our bodies are telling to us. Today we're diving deep into important signs your body might be sending you weeks and even months before a potential heart attack. I know the term heart attack can be frightening, but knowledge is our greatest ally against fear. Many seniors might be experiencing these subtle cues right now, dismissing these signs as just a part of getting older. But what if I told you that recognizing these signs early could change the course of your life? Our bodies have a silent language. They don't always scream. Sometimes they whisper. And these whispers are the early warning signs. They're an invitation to take action, to seek help before a whisper becomes a shout, or worse, a devastating silence. This isn't about scaring you, it's about empowering you. It's about understanding that the dramatic chest-clutching scene we see in movies is often the end of a story, which started weeks, sometimes months and earlier, with far more subtle clues. In this video, we're not just going to list 7 signs, but we're going to explore why they happen, how they manifest differently in old age, and what specific actions you can take for each. Stay with me, take notes if you wish, because this isn't just information, it's a toolkit for a longer, healthier, and more aware life. Sign number 1, profound, unrelenting fatigue, beyond normal tiredness. Our first sign is one that's incredibly common, yet so easily dismissed. Profound, unrelenting fatigue. This isn't the kind of tiredness you feel after a busy day with the grandkids or a long walk. We're talking about a bone-deep weariness, an overwhelming exhaustion that doesn't relieve even with rest. Like simple daily tasks, things which you are used to do without a second thought, might suddenly feel like climbing a mountain. Why does this happen? When your heart is struggling, perhaps due to blockages or weakening, it has to work much harder to pump blood throughout your body. This reduced cardiac output means less oxygen and fewer vital nutrients are reaching your muscles and organs. Your body's cells are, quite literally, starved of energy, leading to this profound cellular exhaustion. For seniors, differentiating this from normal aging fatigue can be tricky. You might already experience some tiredness. The key here is a significant change from your usual energy levels, a fatigue that makes even beloved hobbies feel like a chore, and it persists for days, or even weeks. Imagine Margaret, a 72-year-old who has always enjoyed her morning gardening. Lately, though, she can barely tend to a few plants before needing to sit down, completely drained. This has been her pattern for the last month, a stark contrast to her usual energetic self. Or consider George, 77, who now finds he's falling asleep in his armchair mid-afternoon, something he never used to do, even after a full night's sleep. He simply feels drained constantly. It's so easy to rationalize, isn't it? I'm just not as young as I used to be. Or, I didn't sleep well last night. But this level of persistent, debilitating fatigue is a significant red flag. This kind of systemic exhaustion often builds for weeks as the heart struggles more and more to meet the body's demands. If you're feeling a new, profound fatigue that's out of character for you and lasts for more than a few days, it's a sign your body needs attention. Please, promise me you won't ignore it. Sign number 2, persistent shortness of breath, even with light activity or at rest. Another sign that can creep up on you, a persistent shortness of breath. What doctors call this as dyspnea. This isn't just getting winded after strenuous exercise. We're talking about feeling breathless after activities that were previously easy for you, like walking to the mailbox, climbing a single flight of stairs, making the bed, or sometimes, even when you're resting. What's happening here? If your heart isn't pumping blood forward efficiently, blood can back up into the vessels leading from your lungs. This is called pulmonary congestion, and it can cause fluid to leak into the lungs themselves, making it harder for oxygen to pass into your bloodstream. Alternatively, your heart muscle itself might not be getting enough oxygen to function optimally, especially during any kind of exertion. For seniors, especially those with pre-existing lung conditions like COPD or asthma, it can be easy to misattribute this. But the crucial factor is a new difficulty of breathing or a noticeable worsening of existing breathlessness with activities that were previously manageable. Think about John, 75-year-old. He now needs to stop twice while walking his small dog around the block, a route he's managed easily for years. He tells his wife his wind isn't what it used to be. Or Mary, 70-year-old, who wakes up at night feeling like she can't get a deep breath, needing to sit up in bed to feel comfortable. This has been happening for several weeks now. This is often blamed on weight gain, a lack of recent exercise, or even seasonal allergies. But it can be your heart gasping for help. The heart's inefficiency can lead to this gradual buildup of fluid or strain on the lungs over weeks, causing progressively worse breathlessness. Please, don't ignore it. Speak to your doctor. Sign number 3. Atypical discomfort. Pressure, aching, or squeezing, not just pain, in the chest, arms, back, neck, jaw, or stomach. We tend to think of a heart attack as involving sudden, crushing chest pain, the Hollywood heart attack. But the early warnings, the signs that can appear weeks before, are often much subtler and can be felt in areas other than the chest. This could be a feeling of pressure, a dull ache, a squeezing sensation, a burning, or even an unusual fullness. This discomfort might be in your chest, yes, but it could also be in your arms, often the left, but not always, or your back, especially between the shoulder blades, or your neck, your jaw, or even your upper stomach. It might come and go, or be very mild at first. This is due to something called referred pain, a type of pain felt in one part of the body, but caused by a problem in another area. Because the nerves from your heart share pathways with nerves from these other areas, so your brain can misinterpret where the problem is originating. The key is that a part of your heart muscle isn't getting enough oxygen-rich blood, often due to narrowed arteries, and this is its way of signaling distress. Ladies, this is especially important for you. Women often have heart symptoms that don't feel like the usual chest pain. That annoying jaw ache you thought was jaw joint pain, the back pressure you blamed on bad posture, or that stubborn indigestion, they might actually be signs of a heart problem. Consider Eleanor, 68-year-old. For several weeks, she's been experiencing a persistent nagging ache between her shoulder blades and a sense of fullness in her chest after meals. She's tried every antacid on the shelf. Or Michael, 76-year-old, who experiences a strange, intermittent tightness in his jaw and left arm, especially when he's stressed or after a bit of yard work. He thinks it's just tension. These symptoms are so often dismissed as muscle soreness, dental issues, acid reflux, or stress. But it could be your heart struggling for oxygen. These reduced blood flow can occur for weeks, like small warnings before a larger blockage or event. Any new, unexplained discomfort in these areas, even if it's not severe pain, needs to be discussed with your doctor. Don't ignore these whispers from your body. Okay, friends, let's do a quick check-in right now. We've talked about fatigue, shortness of breath, and atypical discomfort. Have you or someone you know felt unusually tired lately for no clear reason? If yes, just type fatigue in the comments below. Let's see how many of us might be going through this silently. Your comment could help someone else realize they're not alone. It's so important we share and support each other. Now let's move on to our next critical sign. Sign number 4. Unexplained dizziness, vertigo, or fainting, syncope. Our fourth warning sign can be quite alarming. Unexplained dizziness, a feeling of vertigo where the room seems to spin, or even actual fainting spells, which doctors call syncope, which simply mean a temporary loss of consciousness, usually caused by a drop in blood flow to the brain. Why would this happen weeks before a heart attack? It's often due to insufficient blood flow to the brain. This can be caused by a significant drop in blood pressure, if the heart isn't pumping strongly enough, or by an arrhythmia. This is a condition where the heart beats irregularly, too fast, too slow, or unevenly. That disrupts the steady supply of oxygenated blood. When your brain doesn't get the oxygen it needs, even for a short period, you can feel woozy, lightheaded, or lose consciousness. For seniors, it's important to note that many take medications that can list dizziness as a side effect. However, the key here is new unexplained episodes, or a significant increase in the frequency or severity of dizziness. especially if it's not directly linked to postural changes, like standing up too fast. Although even that warrants a check with your doctor, if it's a new development. Imagine Arthur, 78-year-old. He nearly fainted while simply watching television one afternoon. The feeling passed quickly, but it left him shaken. He didn't tell anyone, thinking it was a one-off. Or Clara, 71-year-old, who has had several episodes of intense dizziness in the past few weeks, sometimes feeling like the room is tilting around her, even when she's sitting down comfortably. These experiences are often attributed to just a dizzy spell, perhaps low blood sugar, dehydration, or an inner ear issue. While those are possibilities, it can also be a critical sign that your heart is struggling to maintain adequate blood flow to your brain. An unstable heart rhythm, or a progressively failing pump, can cause these neurological symptoms to appear intermittently for weeks as the underlying condition worsens. Sudden or recurrent dizziness or fainting is never normal. It's a clear signal to see your doctor immediately. Please don't ignore it. As we continue through these important signs, I want to take a moment to remind you this information isn't meant to frighten you. Not at all. It's here to empower you. You are not helpless in the face of these concerns. You are wise. You have a lifetime of experience, and your awareness, the fact that you're watching this right now, is your greatest tool. Recognizing these signs is the first step to taking powerful, proactive care of your precious heart. Sign number 5. Persistent nausea, vomiting, or indigestion-like symptoms. Sign number 5 is one that often pretended as a simple tummy ache. Persistent nausea, unexplained vomiting, or general indigestion-like symptoms that don't seem to have a clear cause. How can stomach issues be related to your heart? The nerves of the heart and the digestive system are closely linked. Sometimes pain signals or irritation from a struggling heart can be felt in the upper abdomen, mimicking indigestion or nausea. Furthermore, if your heart is having trouble pumping effectively, it might divert blood away from the digestive system to prioritize vital organs, leading to these uncomfortable gastrointestinal symptoms. Again, ladies, please be particularly aware of this. Nausea and vomiting can be prominent pre-heart attack symptoms for women, sometimes occurring without any chest pain at all, making them very easy to misdiagnose. For 3 weeks, Betty, 70 years old, has woken up feeling queasy, sometimes even vomiting small amounts, with very little appetite. She's convinced she has a persistent stomach bug that just won't clear up. Or consider Robert, 74 years old, who experiences an unusual bloating and uncomfortable fullness after even small meals, along with a lingering nausea that's entirely new for him. He blames it on eating the wrong things or stress. These symptoms are very easily confused with common stomach ailments, food sensitivities, stress, or even side effects of other medications. But if you have persistent, unexplained nausea, vomiting, or stomach discomfort that isn't typical for you, especially if it's accompanied by any of the other signs we're discussing, it warrants a consultation with your doctor. As the heart's condition deteriorates over weeks, these digestive disturbances can become more frequent and persistent. Don't just assume it's something you ate. Sign number 6, unexplained swelling, edema, especially in legs, ankles, feet, or abdomen. Our 6th sign is a visible one. Unexplained swelling or edema, particularly in your legs, ankles, feet, or sometimes even your abdomen. Why does swelling occur in relation to heart problems? When your heart isn't pumping blood as strongly or efficiently as it should, blood flow can slow down and back up in the veins. This increased pressure can cause fluid to leak out of your blood vessels and into the surrounding tissues, causing them to swell. This is often a sign of what doctors call congestive heart failure, where the heart is under significant strain. Poor heart function can also impact your kidneys' ability to remove excess fluid and sodium from your body, further contributing to fluid retention. For seniors, some mild swelling might not be uncommon, especially if you have existing venous insufficiency or have been on your feet a lot. However, you should look for new swelling that's noticeably worse than usual, swelling in one leg more than the other, or what's called pitting edema, where an indent remains for a few seconds after you press on the swollen skin. Also, be aware if swelling is accompanied by other symptoms like shortness of breath or rapid, unexplained weight gain, as this can indicate fluid accumulation. Think of David, 76 years old. He can no longer see his ankle bones clearly, and his shoes feel like they're strangling his feet by the end of the day. This has slowly worsened over the past month. He's even started sleeping propped up on extra pillows because lying flat makes him feel a bit breathless. Or Grace, 79 years old, who noticed her abdomen felt unusually bloated and her rings were suddenly too tight. She also gained 5 pounds in 1 week without changing her diet. She thought it was, quote-unquote, just water weight. Swelling is often blamed on hot weather, eating salty food, prolonged inactivity, or varicose veins, but it can be a significant indicator of a failing heart. Fluid can accumulate gradually over weeks as the heart's pumping ability declines, making this a very telling long-term sign. New or worsening swelling in your lower extremities or abdomen is a sign your heart may be struggling. Please see your doctor, and don't just put your feet up and ignore it. Sign number 7. New or worsening irregular heartbeat, palpitations, or a sensation of a racing or skipping heart. And finally, our 7th shocking sign relates directly to the rhythm of your heart. A new or worsening irregular heartbeat, palpitations, or a sensation of your heart racing, pounding, or skipping beats. What's behind this? An arrhythmia or irregular heartbeat can occur when the electrical impulses that coordinate your heartbeats don't work properly. This can be a sign of underlying heart disease, high blood pressure, or that your heart muscle is under stress and not getting enough oxygen. Some arrhythmias, like atrial fibrillation or AFib, an irregular and often rapid heart rate that can lead to blood clots in the heart, are quite common in seniors and significantly increase the risk of stroke. Palpitations can feel like a fish flopping in your chest, a strong thud, or a rapid flutter. For seniors, some may already have a known, managed arrhythmia. The primary concern here is new sensations of an irregular heartbeat, a significant increase in the frequency or duration of known palpitations, or if these palpitations are accompanied by other symptoms like dizziness, shortness of breath, chest discomfort, or fainting. Consider Susan, 73 years old. While calmly reading her book one evening, she felt her heart suddenly begin to pound erratically for several minutes. It left her feeling anxious and weak. This has happened 3 times in the last 2 weeks. Or Henry, 77 years old, who has noticed his heart skipping beats much more often lately, sometimes making him cough. He feels a fluttery sensation that's quite unsettling. If these episodes are brief, people often dismiss them as just my heart acting up, or blame them on stress, too much caffeine, or anxiety. While those can be triggers, it can also be a sign of significant electrical instability in the heart. The electrical system of the heart can become increasingly unstable for weeks, leading to more frequent or sustained arrhythmias before a major cardiac event. Any new or concerning changes in your heart's rhythm warrant a prompt medical evaluation. Your heart is trying to tell you something very directly. Don't ignore it. These 7 signs, dear friends, are your body's early alert system. They are not isolated incidents, but can be interconnected pieces of a larger puzzle, painting a picture of a heart that is under growing strain, potentially for weeks or months. The critical takeaway isn't to panic with every ache or pain, but to become a keen observer of changes in your body. New, persistent, or worsening symptoms are your cue to act. So what do you do if you recognize one or more of these signs? Here are crucial, empowering action steps. First, become a symptom detective. Keep a simple health journal. It doesn't have to be complicated. Note down any new or unusual symptoms. When did they start? How often do they occur? What makes them better or worse? Are there any associated feelings or other symptoms? This detailed information is invaluable for your doctor. Second, and most importantly, don't delay. Talk to your doctor and know how to have that conversation. Don't feel you're being a bother or making a fuss. Your doctor wants to know these things. You can say something like, "Doctor, I've been experiencing," mention the specific symptom, for duration, and it's new for me, or it's gotten worse. I'm concerned it could be related to my heart. Be specific. Use your journal notes. Ask direct questions. Could this be my heart? What tests do you think are appropriate? Third, advocate for yourself, or for a loved one. Sometimes, especially if your symptoms are atypical or seem mild, you might need to gently persist. If you're not satisfied with an initial explanation and you still feel deep down that something is wrong, it is always okay to seek a second opinion. You know your body best. Trust your instincts. Fourth, while not an early warning sign, have some emergency preparedness. Know the classic signs of an active heart attack: severe chest pain or pressure, pain radiating to the arm or jaw, sudden severe shortness of breath, cold sweat, nausea. But our focus today has been on the weeks before, to try and prevent that emergency from ever happening. And finally, remember that lifestyle is your powerful ally. While we are discussing these critical warning signs, never underestimate the profound power of proactive heart care. Gentle, consistent movement that your doctor approves of, perhaps a daily walk in nature, nourishing your body with whole, unprocessed foods, plenty of colorful fruits and vegetables, lean proteins, and healthy fats. Finding healthy ways to manage stress, perhaps through meditation, hobbies, spending time with loved ones, or spiritual practices. And, of course, avoiding smoking and limiting alcohol. These are not just good ideas. They are powerful medicine for your heart, building resilience over weeks, months, and years. Let's quickly recap those 7 shocking, often silent warnings your body can give you weeks before a heart attack. Number 1, profound, unrelenting fatigue. Number 2, persistent shortness of breath. Number 3, atypical discomfort, not just chest pain. Number 4, unexplained dizziness or fainting. Number 5, persistent nausea or indigestion-like symptoms. Number 6, unexplained swelling, especially in the lower body. And number 7, new or worsening irregular heartbeats or palpitations. My dear friends, this knowledge isn't meant to fill you with anxiety, but with power, the power to listen, the power to understand, and most importantly, the power to act. If this in-depth discussion has provided you with valuable insight and you believe it could help others, please show your support by taking a moment now to click that like button below. It truly helps our channel reach more seniors who desperately need this information. More importantly, share this video. Think of one person right now, a spouse, a sibling, a friend, a neighbor, any senior in your life. Send it to them. This simple act of sharing could literally save a life, or at the very least, start a crucial conversation. And if you're new here and want to continue receiving vital health guidance tailored specifically for our golden years, please click the subscribe button and then tap that little notification bell right next to it. That way, you'll be alerted every time we release a new video filled with information to help you live your best, healthiest, and most informed life. We genuinely want to hear from you. Please take a moment to leave a comment below. Have you or has someone you know experienced one of these early subtle signs? Did it lead to early detection? Your experience is valuable and can offer comfort, encouragement, and even validation to others in our wonderful community. Thank you from the bottom of my heart for investing your precious time with me today.